Why does the United States pay higher drug prices than other countries? Because America's the only country in the world where 340B hospitals mark up drug prices and PBM middlemen charge billions in hidden fees. Meanwhile, Americans subsidize the research and development for new cures. Other countries benefit, but don't pay their fair share. Crack down on the middlemen. End the free riding. Lower drug prices. Go to balancethescales.org to learn more. Paid for by Pharma.
Put us in a box. Go ahead. That just gives us something to break out of. Because the next generation 2025 GMC Terrain Elevation is raising the standard of what comes standard. As far as expectations go, why meet them when you can shatter them? What we choose to challenge, we challenge completely. We are professional grade. Visit gmc.com to learn more.
I was able to get Dr. Noel Brewer on the line because he had a sudden opening in his schedule. Usually at 3 p.m. on a Thursday, that's when we spoke, he'd be in a working group meeting for the CDC's Advisory Committee on Immunization Practices. Insiders call this group ACIP. But last week, Dr. Brewer and all of his colleagues got fired.
I got an email from a journalist who said, look at this article in the Wall Street Journal. It says something that might interest you. And I read it and found out that I've been fired. First time I've ever...
Hold it. They wrote to you and said, this might have something that interests you. They didn't say what it said?
No. And then I immediately shared it with the other people on the committee, and we got together and we're talking about it. And then one by one, we started to get the official notifications from the government. So I saw the email from the journalist around 4 o'clock on Monday, and then at 5:48 p.m. that night, I received the official email.
So what was the reasoning here? In that Wall Street Journal op-ed, Health and Human Services Secretary Robert F. Kennedy Jr. said ACIP had become little more than a rubber stamp for any vaccine, that the group failed to scrutinize vaccine products given to babies and pregnant women. All of which is a little strange when you consider that ACIP acts more like a second layer of protection for vaccines. It examines FDA-approved products and recommends which people should get them first. People like Dr. Brewer, they took their job seriously. I mean, when you found out you were being appointed to this committee, what did that mean to you as someone who's worked in this field for a while?
It's a career high. It's an absolute peak. I thought, well, it's downhill from here. I have always admired the work that people in ACIP does, and typically it's done by physicians or people who have biological degrees. So it was somewhat unusual to have a behavioral scientist like me join them.
Dr. Brewer's field of study, it's all about what motivates people to get vaccinated in the first place. In light of so much misinformation about vaccines, their safety, their effectiveness, it's worth spelling out what he's found. He says it's really hard to change people's confidence in vaccines. It might help if the people around you are vaccinated, so there's a cultural norm. But then again, that might not help at all. The most important factor, he says, it's simply availability.
That's where we have to start with vaccines, is we have to make them easily accessible and affordable. And once we solve a lot of those problems, then we can move on to problems like vaccine confidence.
It's so interesting. It feels to me like the appointment of someone like you to the vaccine advisory panel was kind of an acknowledgement that we're in a moment where people are doubting vaccination. We need to figure out how to get people to trust us more.
We really do. The business of vaccines and the science of vaccines and the healthcare of vaccines all rely on people's trust in this process. That trust is being steadily eroded by a variety of actors, and it's to the detriment of the public's health.
So, will firing a bunch of vaccine doctors erode the public's trust even further? Today on the show, inside the firings at the CDC. I'm Mary Harris. You're listening to What Next? Stick around. Decisions made in Washington can affect your portfolio every day. But what policy changes should investors be watching? Listen to Washington Wise, an original podcast for investors from Charles Schwab, to hear the stories making news in Washington right now. Host Mike Townsend, Charles Schwab's managing director for legislative and regulatory affairs, takes a nonpartisan look at the stories that matter most to investors, including policy initiatives for retirement savings, taxes and trade, inflation concerns, the Federal Reserve, and how regulatory developments can affect companies, sectors, and even the entire market. Mike and his guests offer their perspective on how policy changes could affect what you do with your portfolio. Download the latest episode and follow at schwab.com/WashingtonWise or wherever you listen. This podcast is brought to you by Progressive Insurance. Do you ever think about switching insurance companies to see if you could save some cash? Progressive makes it easy. Just drop in some details about yourself and see if you're eligible to save money when you bundle your home and auto policies. This process only takes minutes, and it could mean hundreds more in your pocket. Visit Progressive.com after this episode to see if you could save. Progressive Casualty Insurance Company and Affiliates. Potential savings will vary. Not available in all states. As a public health person, I sort of wonder, given the last week or so, is something keeping you up at night these days? Like, are you, I feel like I know a lot of people who have looked at everything over the last week, including what's happening in Los Angeles, and said, actually, what happened with the vaccine committee is more troubling to me. I just wonder if you share that assessment in some ways.
The nation is definitely going through a time when things are quite different than they were even in January of this year. I'm not a political creature, and so I'm not going to weigh in on the politics of this, but it does have political dimensions to it that people are evaluating, and for many of us, it feels new. Yeah.
Back in May, Health and Human Services Secretary RFK Jr. unilaterally changed vaccine recommendations for the COVID vaccine. That normally would have been your panel's job, right?
That's correct.
Was that kind of the first sign to you, like, I'm not sure what we're doing is going to be taken seriously here?
No, we'd had some challenges earlier on. We had the April meeting that was a delay from when it was scheduled in February, so that was a bit of an indication there might be a challenge. The second issue was that we made, I think, 7 recommendations at the April meeting, and only 3 of those have been acted on. The other recommendations have not yet been acted on.
What were those about?
To the best of my recollection, they were about RSV vaccine and then also about meningitis vaccine.
You've mentioned how you read about your firing in the Wall Street Journal. I wonder if it makes sense to kind of go through that op-ed a bit and talk about what it alleges. In it, the Secretary of Health and Human Services, Robert F. Kennedy Jr., calls you and your colleagues little more than a rubber stamp for any vaccine. I wonder how you'd respond to an allegation like that.
I'm going to say this with all full sincerity. I don't have beef with the Secretary of Health and Human Services. I'm not looking to have a fight with him.
He might want to have a fight with you.
Well, I'm a small player. He's important. I'm just one person in a sea of people who do this research and happen to have a committee role. So I just want to say that at the top is I'm not picking a fight with this guy. He did say some things that were quite strong.
I mean, he says that ACIP has never recommended against a vaccine, even those later withdrawn for safety reasons. Is that true?
Exactly. And that is our role, that we only look at vaccines that the FDA has approved. ACIP doesn't approve vaccines for licensure. It doesn't say whether they're legal to provide in the United States. That's what FDA does.
Right, like it's not your job.
It's not something we are able to do. We're not allowed to do it. So we take vaccines that are licensed because they're good enough vaccines and often stellar vaccines. And then we say who should get them, when they should get them, and how many doses.
I mean, Kennedy also accused ACIP members of serving industry interests over public health. Like, he alleged grant funding has skewed ACIP's recommendations. He quoted a 2009 HHS Inspector General report that he said found few committee members completed full conflict of interest forms, and 97% of them had omissions. How fair is an allegation like that?
I will say that 97% number is referring to a different statistic. that 97% includes people putting a number in one column instead of another column, or a word in one column instead of another column. These forms are long and they're complex, and all of us want to declare stuff, but it's not always clear how you would do that. The number of actual omissions is incredibly small. So the 97% number is applying to a different thing that it was quoted as being relevant to. But I want to get back to your comment about conflicts of interest being disclosed. So one of the innovations of the current administration was to make those conflicts of interest just a little easier to see. And I really did like that. There was now a new link, I think, for every meeting that showed every potential conflict of interest. And when you see it, you realize there's almost nothing. And the couple of people who had something just sat aside from those votes. They didn't vote on those topics.
Yeah, I mean, conflicts of interest happen all the time. They happen for Supreme Court justices, too. They decide to sit out a vote.
The main point is that of 17 people, there was maybe 2 small conflicts of interest, and those were pretty trivial, and they were transparently communicated. It's also true that we were allowed to accumulate no new conflicts of interest during our service. We couldn't take any money from drug companies. We couldn't take a grant from them. We were not allowed to be part of lawsuits against drug companies. All that stuff was forbidden. We could not make money off that process.
Yeah. I mean, Kennedy also claimed there wasn't enough transparency in ASIP's work. Do you think that the meetings should have been more open to the public?
They're incredibly open. They're live streamed and people have the opportunity to comment. They're incredibly open. I really do like that.
These shakeups, they're happening at a time when vaccine deniers have been gaining prominence. Dr. Brewer says part of the issue when you talk about vaccine hesitancy is that you're not just talking about one thing, because not all vaccines are alike.
So it turns out we don't just have one kind of vaccine. We have a couple of different kinds of vaccine. One that really are the sort of perfect thing, it really do it all. Some that are in the middle, and then some that aren't very good, but still are better than nothing because they're going to save your life, probably. So HPV vaccine is that ideal vaccine. It really protects you fully and completely against the thing that it's supposed to protect you against. You won't be infected unless you already had a previous infection, but it is like 100% effective, give or take a few tenths of a percent. So that's amazing. It's an extraordinary vaccine with probably lifelong protection. We don't know that yet for sure, but we have maybe 20 years of data to show that it's lasting as long as we're following it. So that's extraordinary. And then you compare that to another kind of vaccine like seasonal influenza or COVID-19 vaccines, and those have a different character to them. Those vaccines have waning immunity that might expire after 6 months or a year. By some estimates, maybe 10% a month for some of these vaccines. And so that's a different kind of a problem. In addition, these seasonal influenza vaccine, COVID-19 vaccines do not protect you so well against infection. What they do is they keep you out of the hospital and they keep you from dying. And that matters a lot. That's really important. But they're 50% effective on those things, or 60%, or maybe 30% on a bad day. So
it opens up space for doubt.
It opens up a lot of space for doubt. It also means then that we have kind of broken the, if not the promise of the vaccine, we've gone against people's mental idea, their hopefulness about what vaccines can be. But what's happened is that people who are anti-vaccine have developed a whole industry. They have also developed a way of being visible that far outreaches their numbers. So they're really winning in that regard. They're very effective communicators, and they're better at telling stories than we are. So people who are pro-vaccine will come in with numbers and statistics and data, but people who are anti-vaccine will use techniques that go back to the 1800s when people were anti-vaccine back then, and they would tell stories about children being harmed in vivid language. And those are the stories that really stick in people's heads.
And they're not true necessarily.
They can be. They absolutely can be true. But yes, it's true. I agree with you that often these stories have misunderstood the relationship between a vaccine and an outcome.
Yeah.
But to your earlier question was, what can we as scientists do to show more compassion for people who believe they've been harmed by vaccines or otherwise had something bad happen to them as a result? And we do have to listen. And we have to listen both with our hearts, but also with our minds. So with our hearts, we should express some amount of sorrow or compassion for these folks. I agree with that. And then at the same time, we also have to look to see what data can we find that will corroborate what they just said. Perhaps it's emerging data that hasn't yet been considered. Or do the data we have say that this is not something that's true across the population. This person believes for themselves that this was the series of events, but that the causal chain doesn't work across the population.
Have you ever had a successful experience of talking to someone about their vaccine hesitancy and moving them forward?
Well, I'm not a physician, and that's a good job for a physician or a nurse or another healthcare provider. We can try to have an influence on people around us, but I think we have to be modest in our goals. One of the things we need to do is realize this is going to take time. You can't just say a magic word and people will just behave. When's the last time someone convinced you to do something? I mean, it's
really hard.
It's really hard. And so health behavior is not an easy thing to change, and vaccination is just one piece of that. When's the last time, someone said one word and that allowed you to figure out how to exercise or brush your teeth or floss or whatever the thing is? So I think we have to be modest about that and think about this as a conversation that is going to happen over many months. And there's a friend of mine who had not vaccinated her son against HPV. And when I heard about this, I was just so surprised. So I first asked her, well, why? And she said, well, I have some concerns. I said, oh, I appreciate hearing that. And then another time, a few weeks later, it might have been a month later, I said, well, what have you heard or what's going on? And she said, well, I heard this. And then I was down. I said, well, what's your main concern? Like, what's really on your mind? And then we talked a little more. And then I let it go. And then I came back, maybe it was a month or two later, and then we talked a little bit more, and she'd thought about it a bit more, and she was sort of more open to the idea. And then about a month or two later, she got her son the vaccine.
So it wasn't nagging. It was being open, listening.
Listening to her, that's the first thing. People can only hear once they've been heard. So if you are not hearing that other person speak, and you're speaking instead, then you've lost. There's no chance you can help them think differently about vaccines.
When we come back, what kinds of vaccines will the new members of ACIP be recommending? Or will they be recommending any at all? This episode is brought to you by Discover. It's smart to always have a few financial goals. And here's a really smart one you can set: earning cash back on what you buy every day. With Discover, you can. Get this. Discover automatically matches all the cash back you've earned at the end of your first year. Seriously, all of it. Discover trusts you to make smart decisions. After all, you listen to this podcast. See terms at discover.com/creditcard. Decisions made in Washington can affect your portfolio every day. But what policy changes should investors be watching? Listen to Washington Wise, an original podcast for investors from Charles Schwab, to hear the stories making news in Washington right now. Host Mike Townsend, Charles Schwab's managing director for legislative and regulatory affairs, takes a nonpartisan look at the stories that matter most to investors, including policy initiatives for retirement savings, taxes and trade, inflation concerns, the Federal Reserve, and how regulatory developments can affect companies, sectors, and even the entire market. Mike and his guests offer their perspective on how policy changes could affect what you do with your portfolio. Download the latest episode and follow at schwab.com/WashingtonWise or wherever you listen.
This podcast is brought to you by Progressive Insurance. Do you ever find yourself playing the budgeting game, shifting a little money here, a little there, just hoping it all works out? Well, with the Name Your Price tool from Progressive, you can be a better budgeter and potentially lower your insurance bill, too. You tell Progressive what you want to pay for car insurance, and they'll help you find options within your budget. Try it today at Progressive.com. Progressive Casualty Insurance Company and Affiliates. Price and coverage match limited by state law. Not available in all states.
So can we talk about what happens now?
No.
Are you saying that just because you don't know?
I don't want to. We're moving into, what do they call it, uncharted territory. This is something new, and there's a lot of people who want to say they know where things are going to go, and I don't think we do. People have said all sorts of doomsday things about the possible new members, and now we have a slate, and now people are trying to pick them apart for whatever reason. And I'm just not going to talk about the new ACIP members. I sincerely wish them well. They have a really tough job. These are people who care greatly about vaccination and probably think differently than I do, but they're the people we have to rely on. And if it turns out that we can't, then the nation's going to have to come up with an alternative to ACIP. I don't know what that would be, and I don't know how that would work out, given that ACIP establishes funding for vaccines through the Vaccines for Children. So half of America's children get vaccines for free through the Vaccines for Children program, and that is controlled by ACIP votes. So if ACIP doesn't vote for it, they don't get the vaccine. So it might be that some other fancy organization can come up with something. But
I hadn't even realized that detail. That's especially alarming to me.
We live with ACIP. It's ours. These are the folks we're going to look to, and they're going to determine whether you and I get a vaccine this fall for COVID. So we got to listen to them and try to figure out how to change their minds if we don't like what they're doing.
I mean, in addition to, getting money for kids who need vaccines who maybe don't have the resources, ACIP also sets recommendations so insurers know what to fund when it comes to vaccines, right? Like, what are they going to cover when you go to the doctor, say yes and no to?
Yeah, we're in a tough time right now because ACIP has lost a great deal of credibility with healthcare providers. This is all the way from the lead organizations, the professional organizations, on down to rank and file members. So we have a situation where the AMA,
the American Medical Association,
released this fiery press release about the changes in ACIP. And then we have the American Academy of Pediatrics, who's no longer going along with ACIP recommendations de facto. It used to be that they deferred to ACIP, and that is no longer the case. We also have a situation where the various professional organizations had come to an agreement and harmonization on recommendations for COVID-19 vaccine. And by DHHS moving out on its own, that undid this harmonization. So at multiple levels, the professional organizations have taken a step back from ACIP, mostly because ACIP has moved away from them.
Well, I mean, I can understand why.
Absolutely.
I mean, I know you don't want to talk about who the new members of the panel are, but I'll lay out a few of them for my listeners, okay? Because they might not know the names and the backgrounds. The people who are appointed as members are people who've been close to Robert F. Kennedy Jr. Like, I'll lay out the biography of one of them because I think it's instructive. This Dr. Robert Malone, who's a biochemist, who's claimed for a long time he came up with the technology that enabled the COVID vaccine, but then spoke out against the COVID vaccine. He went on Joe Rogan's show and Steve Bannon's show. He sued the Washington Post for defamation. That case was dismissed. So you can see this is someone who is an agitator and someone who other people in the medical world had tried to marginalize over the last few years, now given a very big platform with decision-making authority. Fair?
I'm just declining to characterize these folks. They have various opinions, many of which are different than mine. There's a good amount of vaccine contrarianism on the or vaccine skepticism, that might be fair, on the committee. And that seems to be what they were selected for. But I don't have a beef with them. I really am not trying to pick a fight with current ACIP members. They are who's appointed, and we're going to have to look to them to put their best forward. That's what I'm hoping for.
If they reach out to you and say, hey, can you give me some guidance on what it means to be a member of this panel? Sounds like you would say, okay.
Absolutely. We have to help them. They're walking into this with no institutional knowledge. For the most part, they just don't know how all of this has worked in the past. One big change, of course, is that we no longer have overlapping memberships, so that one person would serve for 4 years, and then a year into their tenure, a few new members would come, and a second year into their tenure, a few new members would come, and the third year into their tenure, a few more members would come, and there'd be this constant rotation of people with a lot of institutional knowledge carried across. So the erasure of all of that, along with the elimination of the key CDC staff supporting ACIP, has meant that a lot of that ability to know how best to go from evidence to recommendations has been lost.
Yeah. So I'm a regular American who would like to know what kind of vaccines I should be getting. Where should I be looking for that information now?
For you as an adult, you'd probably look to the American Academy of Family Physicians. They'll do a great job in recommending who should get which vaccines. If you have a child, then you should look to the American Academy of Pediatrics. They also give outstanding recommendations. Both groups have very clear guidance on which vaccines people should get at which ages.
I notice you're not saying ACIP.
I don't know yet.
Yeah.
Many parents won't have a choice. When ACIP makes a recommendation for someone who is getting their kids vaccinated through the Vaccines for Children program, they will get the vaccines that ACIP approves. That's not really an option. That's what will be on the menu. For privately insured people, they may have a choice, either because the insurance companies may go beyond what ACIP recommends or because they may be able to pay out of pocket. But I guess I'll look and see. People were horrified by the idea of COVID-19 vaccine going from everybody gets it to only some people getting it, but it's not far from what ACIP would have recommended when I was there. That change is not so far from where we were at. There's not a lot of daylight between the RFK Jr. approach and what we were about to recommend. There are important differences about pregnant women and young children. Those are areas that would require some resolution. But for the most part, for a 45-year-old healthy person, no medical conditions, do they need a COVID-19 vaccine? Probably not. So I'm open to it. I'm looking forward to seeing what they recommend.
Dr. Brewer, I'm really grateful for your time. Thanks for coming on the show.
Good chatting with you.
Dr. Noel Brewer is the Gillings Distinguished Professor in Public Health at the UNC Gillings School of Global Public Health. Until recently, he was a member of CDC's Advisory Committee on Immunization Practices. And that's our show. What Next is produced by Paige, Osburn, Elena, Schwartz, Rob Gunther, Anna Phillips, Ethan Oberman, and Madeline Ducharme. Ben Richmond is the Senior Director of Podcast Operations here at Slate. And I'm Mary Harris. Go track me down on Blue Sky. Say hey. I'm at Mary Harris. Thanks for listening. I'll catch you back here next time.
Hi, I'm Josh Levine. My podcast, The Queen, tells the story of Linda Taylor. She was a con artist, a kidnapper, and maybe even a murderer. She was also given the title the Welfare Queen, and her story was used by Ronald Reagan to justify slashing aid to the poor. Now, it's time to hear her real story. Over the course of 4 episodes, you'll find out what was done to Linda Taylor, what she did to others, and what was done in her name.
The great lesson of this, for me, is that people will come to their own conclusions based on what their prejudices are.
Subscribe to The Queen on Apple Podcasts or wherever you're listening right now.